By now, you know the medical board is responsible for regulating medicine in Ohio, including making sure that providers take appropriate steps before prescribing, follow the standard of care for treatment of services, maintain proper boundaries between themselves and their patients, and reach out for help if they have concerns of impairment. But we haven't really talked much about the responsibility of a very specific type of medical board licensee, one that can sometimes be an alternative to pain medication or help patients recover from surgeries. In today's episode, we're diving into the world of massage therapy. Are you ready? You're listening to MedBoard Pulse, a podcast by the State Medical Board of Ohio. I'm your host, Jerica Kent, Chief of Communications. Let's talk Ohio. Hello, listeners. I'm so glad you're joining us for today's conversation all about massage therapy. Licensed massage therapists can be found across Ohio. They can be a part of healthcare teams, and they make up roughly 11% of the board's licensee population. Like other license types, massage therapists are regulated by the Ohio Administrative Code and Ohio Revised Code. Specifically, their laws and rules are found in Chapter 4731, which is also where you'll find physician regulation. That's because this profession falls into the category of what's known as a limited branch of medicine or surgery. In the state of Ohio, in order to be eligible for a massage therapy license through the traditional route, you must be at least 18 years old, complete a background check, have graduated from high school, hold a diploma or certificate from a qualifying entity, and pass the Massage and Bodywork Licensing Exam, more commonly known as the MBLEX. Interestingly enough, the board is also responsible for issuing letters of good standing to massage therapy schools. To be clear, the board doesn't regulate massage therapy schools themselves and has no jurisdiction over the students attending there. But what is true is that Ohio law gives the board authority to ensure Ohio massage therapy programs meet the appropriate educational requirements so that when a student graduates from an approved program, they can have the assurance that they have the necessary education and coursework to qualify for Ohio licensure. Per state law, the board has appointed a Massage Therapy Advisory Council that provides counsel to the board on policies and matters that impact the practice of massage in Ohio. I've invited Jack Beacon, a member of that board, to share his expertise in the profession. I'll play that conversation for you now. I hope you enjoy it. Jack, we thank you so much for being here today and explaining and giving information about massage therapy. Can you please introduce yourself and tell us a little bit about your background?
Sure. My name is Jack Beacon. I'm a licensed massage therapist. I'm in my 36th year, I believe, of being a massage therapist.
Wow.
I'm currently the program coordinator and associate professor of massage therapy at Stark State College in North Canton, Ohio. I'm also a member of the Massage Therapy Advisory Council, and I've been teaching for a good 35 years in massage therapy.
Wonderful. As I understand it, our advisory councils are really there to provide advice to the board on, specific professions that we regulate. So you really are an essential part of not just, massage in Ohio, but you play a particular role in the regulatory aspects of massage therapy in Ohio too.
Yeah, and I'm honored to be a member of the advisory council. It's interesting just to kind of see all the legislation that kind of goes on behind the scenes that we don't really hear about. And it's nice having that connection between the medical board and then also the industry. So because I update my students and other LMTs through email contacts and such on a regular basis. And it's great to know when there's changes that are taking place within the industry that we can pass that information onwards. And so it gets out to everybody on a timely manner. But it's nice to be able to work with the others on that are part of the council as well. So we get to hear all this latest information from the legislature that's going on and are able to proceed from there.
My next question for you, what motivated you to enter into the massage therapy profession?
I was motivated from when I sustained a running injury. I had a injury to one of my calf muscles And it was, kind of frustrating when, you can't do the sport that you really enjoy doing.
Right.
And one of my friends at the time suggested that I try massage therapy. So it was kind of like my first exposure to it. So I went to a licensed massage therapist, and in a matter of just a few short sessions, we were able to, get it back to where it needed to be, that I could be out on the road and start to run again. So I was kind of hooked at that moment, and, would ask questions all the time, where did you go to school to learn this stuff? What do they teach in those schools? And before you know it, I'm signing up for a class in massage therapy, and the rest, I guess we could say, is history.
That's a fantastic story. So my next question for you, Jack, would be what education is needed to be a massage therapist?
Okay. Currently, you have to have 600 hours of massage education, and that has to be given by an approved school, um, approved by the medical board. Then once you complete those 600 hours, then you're eligible to take the massage bodywork licensing exam, or MBLEX as we refer to it. And upon passing that, then you can apply for licensure with the State Medical Board of Ohio. Get your LMT.
Awesome. How long so the school program or the program that you would enter into, approximately how long does that take to complete?
600 hours can be done in as little as a year, but like our program that we have at Stark State College takes 4 semesters. So it's approximately 17 months to get from the beginning of the massage program to the end of that.
Okay. And I'm just curious, how many schools are there around the state of Ohio? Do you have an estimate?
Currently, I think off the medical board list, I'd have to count it real quick, but I believe there's probably 25 to 30 schools
Oh,
that
wow.
are around the state that are approved by the medical board to teach massage education.
Wow. And they're all over the state, not necessarily just restricted to like Cleveland or, Toledo, Columbus. They're kind of sprinkled around.
Yeah, they're kind of in pockets, like in the Columbus, Dayton, Cincinnati area. There are quite a few. There's Stark State is here in North Canton, and then there's a couple up in the Cleveland area as well. Um, but they're throughout the state, so somebody should be able to find a school that's fairly local to them if they're interested in enrolling in a massage program and be able to take some classes.
Awesome. We have a lot more to discuss, but first we'll hear from our favorite medical director, Dr. O'Neill, for a Medical Minute segment. Let's enjoy. We'll be right back. Hello, Dr. O'Neill. What are you here to share with us today?
Jerica, thanks so much for having me. It's summertime, it's hot here in Ohio, people want to be outside, so I think it's really an important topic that we discuss, sun safety for the entire family.
That makes a lot of sense.
A small amount of sun exposure is pleasurable, and everybody needs some sun exposure to obtain vitamin D. Vitamin D helps calcium absorption to make our bones stronger and healthier. So it's important that we do get some sun, but not too much.
Understood. What about tanning? Tanning is such a popular pastime. What are some of the risks associated with too much sun exposure?
Sure. Tanning is our skin's response to UV light. We get UV light from the sun, and when UV rays reach the skin makes more melanin. The melanin is the color pigment in our skin that causes tanning. And essentially, a suntan represents skin's injury by the sun. You get a sunburn. This develops when you get too much UV damage and the protection of melanin is not sufficient to protect the skin. So that's why we get a suntan. And unprotected exposure to the sun, ultraviolet rays, causes damage to the skin, such as premature skin aging. No one really wants to look older than they really are, unless you're 8 years old and you want to look 12. But, we want to look young as long as possible. 1 in 5 Americans will develop skin cancer in their lifetime. Each year, more cases of skin cancer are diagnosed in the United States than new cases of breast, colon, prostate, and lung cancer combined. So it's incredibly important that we protect our skin. And you can also damage your eyes. Premature cataract formation and other things can happen.
Are there ways to protect yourself from those consequences?
Sure, the best way to protect yourself is to limit the sun's exposure. It's important that, we do several things. Wear protective clothing, hat, sunglasses, long sleeve shirt, pants. You can look for clothing that has, a UV protection factor. But if we're outside and we're in the sun, we definitely need to put on sunscreen, look at the sun protectant factor, definitely reapply every 2 hours or after swimming or, when you're sweating, you need to keep, putting that sunscreen on. You definitely need to keep some lip balm on your lips to protect your lips. We all want to go to the beach, sand, water, but you got to be really cautious because they, do reflect the sun's damaging rays and can increase your, chances of a sunburn. You can get vitamin D through a healthy diet, so you don't need to get it just from the sun. And, don't go to a tanning bed. If you want to look tan, put on a self-tanner. Also use sunscreen. Tanning beds can cause premature aging of the skin.
If you were to sum up some recommendations to patients or to moms and dads hanging out with their kids this summer, how do you make sure that they're still able to have fun this summer, but they're also thinking ahead and being careful?
Sure. The most important thing is to seek shade when appropriate. Remember, the sun's rays are highest between 10 a.m. and 4 p.m. So also, if you're there and you can see your shadow and it's shorter than how tall you are, you really need to seek shade because you're going to get burned. That sun's coming for you. And it's important to examine your skin on a regular basis. If you see something, that's changing, growing, any bleeding, you need to seek a healthcare provider. Remember, skin cancer, very treatable if it's caught early. And I always tell people, to remember this saying: slip, slop, slap, and wrap. Slip on a shirt, slop on some sunscreen, slap on a hat, and wrap on those sunglasses. And then have fun outside. We do need some sun exposure. It's pleasurable. It helps us get a good night's sleep. So just not too much, and remember to limit your exposure and protect yourself.
Thank you so much, Dr. O'Neill. I'm so happy it's summer and I love all the activities that it comes with, but it's something for us to keep in mind as we have fun in the sun.
And remember that saying.
Absolutely. Slip, slop, slap, and wrap.
Perfect.
Thank you so much. Welcome back to the show. Today I'm talking to Jack Beacon, a licensed massage therapist, and we are learning all about massage therapy. Of course, we're having this conversation because massage therapists are licensed by the medical board. So as licensees of the medical board, massage therapists are also subject to board law and rule. Are students taught about their licensure responsibility in the schooling process on that part of that 600 hours?
Yeah, as part of their education process, they are taught a lot of Ohio law. So they have to be aware of, obviously, their scope of practice, what they are able to do, what procedures they are, and other types of modalities or things that they cannot do. They also have to be aware of how often do they need to renew their licensure. So there's things that are different rules and statutes that are with the medical board that, we have to go through and make sure that they are aware of all of those processes.
That's a very helpful explanation. I know the general patient population or just people, they know about, like, they've heard about massages, right? So they know, like, there are wellness centers or spas that have massages or beauty businesses. What other settings are massage therapists commonly found in the more clinical side?
Well, in addition to the spa settings, which are very popular, we see that massage therapists are also involved in chiropractic offices and physicians' offices. We do have massage therapists that are working in a hospital setting. We would obviously like to see more of that happen down the road. There are a lot of students that decide that they want to go into business for themselves and be that sole proprietor, own their own business, or maybe they go into business with some others that already have maybe an established business. Um, offices of healthcare practitioners. We work right along and work very well with physical therapy,
Hmm.
occupational therapy. You got students that may be interested in working with athletes and different sports or sports teams.
That's a
So
very good point. Yeah.
there's a variety of things that are really available to anyone.
That's a wide variety of settings that we can expect to see massage therapists. And I don't even know if I have thought about all of the places that you indicated. And it makes sense too, but there would be certain industries that would kind of gravitate, people could gravitate towards, like athletics and sports. That's how you got into massage yourself, because of
Yeah,
a sports
absolutely.
injury.
Right.
Um, why is it important? Because we know that massage therapists, when they're completing their programs or passing the NBLEX, they are learning important things about the body. Why is it important to visit a licensed massage therapist specifically, and some instead of going to someone that is not licensed by the board?
Yeah, somebody that is a licensed massage therapist has been through the education process. There is a lot of anatomy and physiology that they have to learn about the human body. They need to know all the names of the bones and the muscles, and of course, the actions of all the muscles and how everything works. Because when we simply put our hands onto somebody, we change their physiology. There are internal changes that are taking place, and they need to be aware of, when is it appropriate to move some blood flow through a blood vessel or some lymphatic fluid through a lymphatic vessel. There may be some cases where you have a patient that has some kind of a contraindication. They have maybe a disease process that contradicts you doing massage to that part. So they need to be educated to know when they can work on that area and when also they should not work on that area. So there's a lot of detail that they really have to learn about the body and how it functions, and then also to be able to pass the licensing exam as well. But we also have a clinical process that they have to go through in which they get to work on a wide variety of people in a clinical setting under supervision.
Hmm.
So that way it's not just somebody that just maybe watched a video on YouTube and said, well, I can do this massage thing, and could
Oh,
be
that
out
definitely
there
happens.
maybe, yeah, and they could be out there maybe applying too much pressure and causing harm to their patient rather than good.
I know, actually, ironically, I had a massage just on Monday. Today's Tuesday, so just yesterday. And I was told, you have a lot of tension in your back. We need to make sure we can do X, Y, or Z. She kind of had a plan and an idea about how to help my body feel better, instead of me just going and listening to some calm music.
Right.
It's been really helpful to go on a regular basis and to have um, someone who understands the muscle systems and all that and how things work together.
Yeah, and we have a clinical class that I teach in which we bring in patients with different medical conditions, and we spend anywhere from maybe 3 to 5 consecutive weeks on just that one patient, just
Oh,
seeing
wow.
if just kind of like a follow through. Are we able from beginning to the end in that 3 to 5 weeks able to help this person? And so
Mm.
it's really kind of their first opportunity to really look at like doing some good therapy, rather than just relaxation massage, which is still valuable
Mhm.
for a lot of people because we, as a society, just need to chill a little bit.
Just a
Um,
little bit. There's a lot to make us unchilled out, that's for sure.
yeah, but they get that opportunity to have that experience.
We were learning so much today about why massage therapy is important, and the educational requirements, and why you should go today, to go see your local massage therapist that's licensed by the medical board. We're going to be right back after a brief break, and we'll learn some more.
What does the medical board have in common with cotton candy, livestock shows, and a merry-go-round? We'll all be back at the 2025 Ohio State Fair this summer from July 23rd through August 3rd. Stop by our booth in the Bricker Hall Marketplace to chat with a board representative and take home some cool swag. We can't wait to see you there.
Ohio listeners should be aware of the risks when visiting retail IV therapy clinics operating in the state. The Medical Board has partnered with the Ohio Board of Pharmacy and the Ohio Board of Nursing to release a joint regulatory statement highlighting patient safety concerns and the standards that should be met by providers in this emerging sector. For more information about this statement, visit our website, med.ohio.gov, click on the tab Laws and Regulations, and navigate to the Position Statements page.
You're listening to MedBoard Pulse, a podcast from the State Medical Board of Ohio. I'm talking with Jack Beacon about the practice of massage therapy, and we're learning some more today. Jack, what are some of the benefits of massage that patients can experience?
All right. Well, I have a list of just a few things. Of course, everybody knows about stress reduction, and it can help to reduce anxiety, right? But we also see that massage therapy can help relieve pain, can improve sleep, can boost your immune system, very important for fighting off and warding off some colds and flus and such. It can
Didn't know
improve
that.
your circulation, increase flexibility, enhance athletic performance. And with those athletes, as they're working out, it can also lead to faster recovery. So they
Absolutely.
have better performance there. We can reduce inflammation, decrease muscle tension and soreness. That was my calf area that we talked about earlier. Can help improve your balance, your coordination. And then we work with a lot of chronic conditions. You have a lot of patients that have fibromyalgia or arthritis or conditions like carpal tunnel syndrome that a massage therapist can work with. And, more importantly, I think we have to really promote well-being and relaxation to patients.
Those are all fantastic benefits and things that everyone should hope for and want, and to feel better about themselves, to feel refreshed, and to have better movement in their body. So I'm
Yeah,
right now. It sounds like there's no reason why everyone should not be getting massages on a regular basis.
exactly. A lot of people always think that, getting a massage is a luxury type of thing. And, I can't afford to do that and such. But it's really needed just by everybody. And you don't have to see a massage therapist every week. You can see a massage therapist once a month or, a couple of times a month or however frequently that, you decide that, fits within your own healthcare plan.
sounds like it sounds like you don't have to necessarily wait until an injury occurs to get a massage, but that even just your everyday working conditions may impact your body in a way that, you could benefit from getting a massage. Is that right?
Yeah, and in fact, I was just thinking that there are a lot of businesses that hire massage therapists to come in for like a wellness day.
Hmm.
And so, a massage therapist can travel. You don't have to have an office. Your office could be your car. You
Hmm.
could just, take a massage table or, with you or a massage chair and take it with you and travel to different places. And some businesses bring in massage therapists with their massage chairs and have a wellness day. And so for, 10, 15 minutes, you get a nice little chair massage to help reduce some of your stress from the day and just kind of relax you a little bit. And maybe from sitting in your chair for a long period of time, working on your keyboard and your computer, this helps to relax you. And plus, because of some of the benefits like boosting your immune system, this can be very beneficial for the employer as well, because maybe there's patients that or people that'll have less sick days
Hmm.
because they have that massage that comes in on a regular basis and just kind of, gets us ready for the second half of the day.
Hmm. I think we should enact that here at the medical board, so I'm gonna count on you to get that passed.
It's
Tell
a
me
little
then
far for
why.
me to bring my students, but maybe Columbus State or somebody can help you.
That's right. Actually, that leads me to another question, the student aspect. So you mentioned that students then get the kind of hands-on clinical hours as well under the supervision of a licensed therapist. What if someone was interested in partaking in that? Can they? How does that work?
Most schools have a student-led massage clinic, and so you can contact the school or the massage program and see, when they run their clinicals. Is there a certain day of the week or certain times that those massages are available? And they usually do it at a reduced cost. So for Stark State in our North Canton area, we have a reduced rate for all the faculty, staff, and the students that are here at the college. And then we have a rate for the public as well. And we have a lot of public demand. Um, a lot of people trying to get in on a regular basis and get, their massages. And we just don't have enough students to accommodate all of the requests for massage that we have.
I see. Good to know. You've kind of answered this question already in many different ways, but if you were to sum it up, why is massage an important profession?
Right. I think massage is an important profession because we're part of a healthcare team. We don't want to just be, over here by ourselves as the massage therapist. I think that we all coordinate and cooperate very well together. So, physical therapists, occupational therapists, massage therapists, physicians, chiropractors, I think we all work very well and if we all have the focus of um, promoting health and well-being in our patients, I think that that's a great goal to have. Massage therapists like the profession because it's a flexible work schedule. You can do 2 massages a day. You can do 6 massages a day. You can work as little or as much as you want. Um, and one of the things that I really try to uh, encourage my students to do is make sure that not only are they helping their patients and such, but they're educating their patients about the
Hmm.
benefits of massage therapy so they can pass those benefits or some of those um, that information on to other people. And
Hmm.
so other people learn about massage therapy. And so we don't have any kind of negative connotations about massage therapy or the massage parlors and things like
Mm-hmm.
that. And again, why you seek out somebody who's licensed. And patients can find a licensed massage therapist if they go to the medical board website. There's a way that they can look up to verify if somebody in their area is licensed.
I'm so
So that
glad you brought that up. Absolutely. What are students taught, like, or how are they educated to make sure that they are keeping appropriate boundaries and what's the responsibility on their part?
students are taught from day one about ethical types of situations and conversations that they have to have. They're in power because they're standing over the patient who is laying on the table or sitting in the chair that may be in various stages of dress or undress, and they have the power at that point, and to not abuse that power, but to be able to have open communication with their patients. So they realize that if they're working a little too deep on their patient, that the patient is comfortable with passing that information back to them. They go through a lot of not just business course work, but some ethic work as well. So they're aware of all those situations, and they're aware of Ohio law, what any kind of consequences are if they um, break the law or if they behave inappropriately with any patients.
Mhm. And we realize too that it's not always the provider, it's not always the therapist, right, who could be in that position of pushing a boundary. Sometimes it's the patient or the client who maybe have kind of nefarious intentions or, you know, trying to do something. So I feel like that's something also that's taught then to students to keep the boundaries no matter what.
Right, to keep a professional boundary at all times, and then what to do if something like that inappropriate behavior does start to happen, how to be able to stop that behavior and either continue on with the massage or stop the massage at that point.
What do you find most rewarding about the profession?
As an educator, I find that it particularly educating the population, not just my students in the classroom, but educating the population about the benefits of massage therapy. And it's wonderful when you get to see people that you work with or work on as patients, when you see those improvements that start to take place. Particularly when you have somebody that maybe has some kind of a chronic illness or something that's going on, and you're the person that's been able to help them. And it's not that we're healers in any way. We just help the body facilitate healing. And so we may, work on a muscle and take the tension out of it, or increase the blood or lymphatic flow through that area that helps it heal. And so, those are all beneficial, kind of seeing that. And I like when the students are in school and you see them like very early on, just, learning some basic skills. And then like we just finished a week of classes and had final exams, and just seeing how much they grow during that period of time. And that, I feel confident putting them out there in the industry that they're going to be successful massage therapists.
What advice do you give to anyone that's considering entering the profession?
Check out the massage schools in your area, see what they offer as to what type of program do they offer, what kind of courses, are involved in the process. Everybody has to be at a minimum of 600 hours now. We have a few schools that are going to be a little bit, we can be over and above that, but 600 is the minimum number that we have to have at this point. And ask them about their passing rates for their students on the licensure exam. How well are they doing? How many people are they graduating on a regular basis? Check out the cost of the education, because the cost can kind of, vary a little bit between like a community college or a privately owned massage business. But, just kind of, do the homework and just kind of check things out in the area and see, where you feel very comfortable at. Sit in a couple of classes if they permit that, to kind of see what goes on in the class and the interactions that take place within that school.
Awesome. Is there anything else you want to add, or any other advice or just thoughts you have in general?
Obviously, it's a great profession, or I wouldn't be in it for 36 years.
Right. I hope you learned something new about one of our license types. The important thing to remember is that the massage therapist, just like any other licensee of the medical board, must follow Ohio laws and rules. And if you or someone you know is interested in pursuing a massage therapy career, visit med.ohio.gov to view all the licensure requirements. That's all we have for today, but remember to tune into our next episode to learn about a growing issue in the world of massage. You don't want to miss this. Thank you for listening to this episode of MedBoard Pulse from the State Medical Board. Special thanks to our guest, Jack Beacon, for giving an inside look into the profession and sharing his own story about how he entered into the field. Subscribe today to hear our episodes right away. For more information about the medical board, visit med.ohio.gov. You can also email questions or comments to communications@med.ohio.gov. And remember, the more you listen, the more you'll learn, the more you'll share.